Thank you for choosing Peace Health Southwest for your total joint replacement surgery. Our goal for you is to ease any anxieties, learn the process of our total joint program, and help you gain the confidence with your new total joint replacement. In this class, we will cover many topics. Please have a pen and paper ready to take any notes that you may like. If you have had your preoperative appointment at Peace Health Southwest, I will be referencing parts of your education folder. If you do not have that information yet, please just follow along. We will be going over how to prepare yourself for surgery, preparing your home, planning for discharge, obtaining medical equipment, and the importance of your coach. If this is your first total joint replacement at Peace Health Southwest, we will touch base on where to go, what to bring, how to manage your pain after surgery, and what the procedure for discharge will be. It is also important that you know how to prepare yourself for success after you discharge to home. In this section, we will review how to best prepare for your surgery before you arrive to the hospital. Before your surgery, the pre-anesthesia clinic at Peace Health Southwest will call you to make an appointment. To proceed with surgery, you will need to be medically cleared by a provider at the hospital. At this appointment, you will complete work such as labs and an EKG. Based on those results, you may require additional testing and consultations with providers such as a cardiologist. You will also receive preoperative instructions and a shower kit. At this appointment, please be prepared to discuss all of your medications and supplements that you are taking. If your medications change at any time, please let the provider know. It is very important to prepare before surgery. In your pre-op folder, you will receive exercises to begin working on. This is especially important for patients receiving a knee or hip replacement, as you will want to focus on strengthening both your upper and lower body parts. You will need upper body strength when using a walker and getting out of chairs. For patients receiving a shoulder replacement, work on your cardiovascular health and practicing activities with only one hand, as you will feel limited after surgery. Now is the time to stop using substances. If you smoke or use tobacco of any form, it is important that you stop 6 weeks prior to your surgery. Please do not use any alcoholic beverages for at least 2 days before surgery, and no forms of marijuana or THC for at least a week before your surgery. All of these substances can drastically interfere with anesthesia as well as the healing process. Your diet also plays a big role in your wound healing process. Please focus on a high-fiber diet with fruits and vegetable servings. Protein will help with overall strength and healing. Eating lean proteins and nutritional shakes are great options. Before surgery, it will be a good idea to prepare meals that will be easy to heat up. Many patients will make a variety of foods and put them in the freezer so that they are ready to eat after surgery. Many patients find it useful to prepare their home prior to surgery. Overall, we want you to succeed by reducing your risk of injury from falls and having all the resources that you need ready to go. There are many useful devices that you can order or borrow before your surgery that will help make your recovery process easier. Every hip or knee patient will need a front wheel walker. If you're required to have a walker for surgery, please purchase it ahead of time and practice walking through your home with it. You may find that you need to move rugs or other furniture, as those may pose a tripping hazard. Many patients often prefer to have a bedside commode or a urinal available to help with nighttime bathroom trips. Chairs with armrests can make it easier for all total joint patients to help them stand up while they're having limited range of motion. Ice can be a helpful tool after surgery, and many patients like to make bags ahead of time to keep in their freezer that are ready to use. If you are interested in having an ice machine after surgery, Please reach out to your surgeon's office as they can help you access one. If you are somebody that lives in a multi-level home, you may find that it is better to have your living arrangements set on one floor. Many patients prefer to relocate to the same floor as their kitchen and/or bathroom to avoid stairs. And while we all love our pets, you may find that it is best to arrange for somebody to watch them or keep them in a restricted area in your home, especially if your pets like to jump or could get under your feet easily. These pets can cause a fall risk and increase your risk of infection as well. In addition to preparing frozen meals, you will need to prepare your home with clean laundry and bedding, having fresh towels set out with clothes that are easy to put on after surgery. It may be a while before you can take on your regular chores. Before surgery, you may want to deep clean your home and do any yard work that you may need. And last, please stock your medicine cabinet. Grab stool softeners, laxatives, Tylenol, and fiber ahead of time. Discharge planning is one of the most important things that you can do for yourself before surgery. It is likely that you will discharge home the day of your surgery or early the next morning. You will need to designate a person to be your coach for surgery. They will be your point of contact that will help you discharge from the hospital and will be at home to help you recover as well. Discharge planning includes where you are planning to recover. Will you be at home with family and friends support? Do you have too many stairs or live alone and need somewhere else to stay? You will need 24/7 care after surgery, especially in the first several days. Skilled nursing facilities are never guaranteed. It is also important to know that they are often not preferred by your surgeons. Many insurances end up declining the use of a skilled nursing facility and could result in you having an unexpected bill. Please understand that it is your responsibility to make a safe discharge plan prior to surgery. It is very common to stay with friends or have family and friends travel from out of town to help stay with you. So, what is a coach? Your coach is someone that you can trust to be reliable, will assist you with getting to appointments, and will be staying with you in the same home. They can be a family member, a caregiver, a friend, or even more than one person. Please do not underestimate the help that you will need. Falls happen when we move too quickly and we don't ask for help. You will likely need this person to help you with dressing or bathing at home, so please pick somebody that you feel comfortable with. In your education material that you will receive from the hospital is a list of places where you can get durable medical equipment. Durable medical equipment are items such as bedside commodes, wheelchairs, and walkers. Please take a look at this information in your folder. There are free and discounted options if you are unable to borrow one from family or friends. Please understand that the hospital is generally unable to provide these items or may be at a greater cost through your insurance. When looking at this slide, please note which surgery you are having and what items are recommended. As you can see, total hip and knee replacements require a front wheel walker. It is also recommended to have raised toilet seats, shower and/or tub chairs, and possibly a bedside commode. Hip kits are useful for patients with limited range of motion that may need assistance putting on socks or shoes. Reacher tools are also very useful if you need assistance picking things up. It's not always easy to find the right type of walker for surgery. When sizing a front wheel walker, your wrist should rest comfortably just at the handlebars. If the walker is too tall or too short, it can lead to injuries and discomfort. If you are a patient that's under 5'4", generally a junior walker is recommended. However, if you have a higher BMI or are near or above 300 pounds, please consider getting a bariatric walker. These generally have a slightly wider base, which makes it safer and sturdier when walking around. Understand that front wheel walkers have only 2 wheels. If you have 4 wheels on your walker, please know that this is not the correct time to use that. 4-wheel walkers are great options for many patients, but after having a total joint replacement, they can often move too quickly and lead to injury, so please make sure that you bring the correct kind to the hospital. Before your surgery, you will need to complete showers that are intended to reduce the risk of surgical infections with a soap provided to you by the anesthesia clinic. There are 4 showers in total that you must complete before surgery. Your first shower will be 3 days before surgery. The next is 2 days before surgery, then the evening before surgery, and the last one being on the morning of your surgery prior to your arrival at the hospital. Please be sure to follow all instructions that will be provided to you by the pre-anesthesia clinic and refer to your folder as needed. In this section, we will talk about what you can anticipate during your stay at the hospital, whether it's just for one day or if you're staying overnight. You will be receiving a call from the hospital with your surgery time, as well as the time to arrive at the hospital. These calls typically happen after 5 p.m. the evening before your surgery. If your surgery falls on a Monday, you may receive a call the Friday before. During this phone call, they will remind you when to stop drinking and eating before your surgery. Your surgery will be taking place in the Furstenberg Tower located off of Mill Plain Boulevard. Please proceed to the Angelo Lobby entrance for your medical clearance appointment, preoperative labs, surgery check-in, and to fill your prescriptions. On this slide is a map of the Peace Health Southwest campus. When looking at your folder, you will be able to use this as a reference to know where to go on the day of your surgery. On the evening before your surgery, please remember to take your third surgical shower. Be sure not to put on any lotions or products on your skin after, including makeup or deodorant. Set out fresh towels and change your bed sheets, and remember to keep pets off the bed to reduce your risk of infection after surgery. After midnight, do not eat or drink, with the exception of clear liquids as instructed by your pre-op nurse. On the day of your surgery, take your fourth and last surgical shower. Do not apply any products such as lotions, makeup, or deodorant. Please arrive to the hospital at your designated time, and if you received a pre-surgery carbohydrate drink, be sure to drink this at the specified time given to you by your pre-op nurse. If you are a diabetic that takes injectable medications, this will not apply to you. Packing can be very stressful before surgery. Please look at the surgery preparation list in your folder to know exactly what you will need to bring. Your hospital room may feel small, so please only bring the essentials such as your coach, walker if you are required, your insurance card, driver's license, and a form of payment for any prescriptions. You will also need to bring loose-fitting clothing. Sweatpants, loose shorts, and pajamas are great options for patients having a total knee or hip replacement. If you are having a shoulder surgery, please bring a zip-up top or a button-up top, but be sure not to bring any jeans or tight-fitting clothing. We will need to be able to access your surgery site and assess your bandage to make sure that you are safe to discharge home. If you are one of the patients that will be staying the night, please bring your personal hygiene products, your CPAP or BiPAP machine if you have sleep apnea, and if you wear glasses, dentures, or hearing aids, please bring those as well. Hospitals are known to be noisy. Many patients like to bring eye masks or earplugs to help them have a restful sleep. Be sure to bring a list of all medications that you are taking and how you take them. But remember, you do not need to bring your physical medications to the hospital. During your stay, you may have the opportunity to work with physical and occupational therapists. Our goal is to help make sure that you are able to go home safely and determine any outstanding needs that you may have. Together, you will work on goals of recovery, coach expectations, how to use medical equipment, navigating stairs, getting in and out of bed, and exercises for therapy. Occupational therapists will also help provide an extra emphasis on dressing, bathing, and toileting as needed. Not every patient will require these therapies. It will be determined by your surgeon and healthcare team. Pain management is very important after a total joint replacement. By far, the best method to manage your pain is to focus on frequent and light movements. Resting in one position for too long will cause additional stiffness and discomfort. While you are in the hospital and resting in your bed or chair, work on range of motion exercises that are appropriate for your surgery, but be mindful not to overdo it. Ice is very helpful in the first week after surgery. Please be sure to ask your nurse and caregivers to refresh your ice if needed. If ordered by your surgeon, Tylenol will be provided to you at scheduled intervals. Narcotic pain medication will also be available, but only as needed. You must ask your nurse to bring this to you. This is not a scheduled medication. When taking medications, your nurse will ask you to rate your pain from 1 to 10 to determine which medication would be appropriate for you at that pain level. If you are one of the patients needing an overnight stay, please understand that the hospital policy does not allow for overnight visitation. Current visiting hours are between 8 a.m. and 8:30 p.m., with the one exception for coaches that are required to arrive early. The morning after your surgery, you will be waking up early. We understand that sleep is important, so we will try to limit disruptions and bundle your care as much as possible. Labs are usually drawn between 3 and 4 a.m. to have them resulted in time for your surgeon's review. We will have patients up, dressed, and sitting in a chair around 5:30 a.m. Your surgeon or PA will typically round near this time and want to make sure that you are progressing well. Coaches are required to arrive to the hospital between 7 a.m. and 8 a.m. They will help you with any scheduled physical therapy and listen to your discharge instructions. Our pharmacy opens at 9 a.m. and prescriptions are usually ready shortly after. Our estimated time of discharge for you will be between 9 a.m. and 10 a.m. So it's extremely important that your responsible ride is ready and they have postponed any other obligations they would usually have for that day. Here at Peace Health Southwest, we really want you to have a safe recovery. In order to be cleared for discharge, you must be able to meet all discharge criteria. That includes being able to urinate, tolerating eating and drinking, you're able to safely walk and participate in basic activities, and you have a safe discharge plan with your coach ready and present. In order to receive medical clearance, you must be seen by all providers following your care and to receive the green light to go home. Once you've left from the hospital, you will be responsible for your care. In the next few slides, we will go over how it is best to recover at home. On a daily basis, you are responsible for assessing your surgical area for any new signs of infection. To do this, you are going to be looking at the outside of your bandage, but please be sure not to remove it unless you've been directed to do so specifically by your surgeon. To assess for any signs of infection, you are looking for new drainage or discoloration. Please note if you have any sense of an odorous smell. If the area begins to feel hot to the touch, you have redness or a rash, or maybe you develop a new fever, please be sure to notify your surgeon immediately. Understand that bruising is completely normal. and expected after an orthopedic surgery, but notify your doctor if you are ever concerned at any point during your recovery. Most patients go home with a surgical bandage that looks like the one shown on this slide. At the hospital, it's commonly referred to as an island dressing. It looks like a laminated piece of gauze that does remain in place until your follow-up appointment, like specified earlier. This is intended to be a waterproof dressing, so you are welcome to shower with it in place. However, do not scrub at it or saturate it. Please just be gentle with your care. If your bandage starts to lift, or maybe the edges are peeling back, or perhaps a wrinkle is letting water in, maybe it just no longer looks clean, dry, and intact. Please let your surgeon know. Oftentimes, they can do a quick dressing change and a surgical site assessment at their outpatient clinic. Blood clots are a risk with any surgery. The signs and symptoms typically include swelling in only one arm or one leg. Please understand that it does not have to develop on your surgical side. Signs and symptoms can vary from person to person or even by instance. Generally, your limb will become tender, warm, reddened, or throbbing. You may even develop a sudden shortness of breath that is not normal to you. Your surgeon will prescribe blood thinning medication. This medication is intended only to be taken as directed by your surgeon. When taking a blood thinning medication, it is important not to combine other blood thinning medications. The ones we commonly have at home are over-the-counter pain medications such as ibuprofen, naproxen, Aleve, Advil, and Motrin. You also may be prescribed to wear compression stockings. At the hospital, we have a saying that motion is lotion. While in the comfort of your home, please aim to walk every hour for about 2 to 5 minutes at a time. Our goal for you is to engage in frequent light movement to reduce the discomfort and swelling. Your inflammation cycle typically peaks within the first 36 to 72 hours after surgery. Ice is very effective in reducing swelling and discomfort, and Tylenol may be prescribed by your doctor. Please only take this as prescribed, but be sure not to exceed more than 3,000 milligrams within a 24-hour period. By taking Tylenol consistently, you may find that you're needing to rely less on narcotics during your recovery. Narcotics will be your last line of defense. Please only take these as needed, but first, try to rely on walking, ice, and Tylenol. Do not operate machinery while on narcotics, and also until your doctor clears you. Please try to prioritize sleeping at night during your recovery. You may find that it is more comfortable to sleep in a recliner, especially if you are someone that moves a lot during your sleep. For patients that had a hip or knee replacement, you may be able to sleep on your side, but if told to do so, be sure to place a pillow between your knees, as seen in the picture in the middle. Knee patients, you have a very important rule. Do not place a pillow or ice behind your knee. This will leave your knee in a bent position and can cause unwanted scarring and will limit your extension overall. For shoulder patients, support your surgical arm with a pillow behind your shoulder and under your elbow. Many patients after a total shoulder replacement find that they prefer to sleep in a recliner for added support. Unfortunately, at the hospital, constipation is one of the most frequent reasons for patients to be readmitted after surgery. A lot of this comes down to anesthesia and pain medications, and it is very common for patients to experience. But please understand that the severity of this occurrence is in your control once you go home. Try to focus on a high fiber diet with lots of fruits and vegetables. In order for fiber to do its job, water is necessary, so please stay hydrated. Most patients take stool softeners in the morning and at night. If you happen to know that you are prone to constipation, especially after surgery, please add in a daily laxative. If for whatever reason you're still not having a bowel movement at least once every 3 days, please be sure to notify your doctor as soon as possible. Many patients will go home with compression stockings. Generally, these are reserved for patients that are undergoing a hip or knee replacement. Our goal for these patients is to have them on at least 23 hours a day. Please be sure to remove them for showering or washing them, and understand that they are hand washed and air dry only. The amount of time that they are required to be on is at your surgeon's discretion. Typically, this ranges between 2 to 6 weeks. When you are home, assess your skin daily to make sure that there are no skin injuries occurring underneath the stockings. After surgery, your surgeon may advise you to continue physical therapy in the outpatient setting. A lot of these patients that participate in physical therapy like to take pain medication prior to their sessions to help reduce anticipated discomfort and limit muscle guarding. Together, your doctor and physical therapist will help you understand your physical limitations and when you are able to advance with your durable medical equipment, such as using a walker or sling. When at home, be sure to do your exercises and stretching on a regular basis. After all, your recovery is in your hands, and we want you to see you succeed. On behalf of Peace Health Southwest, I'd like to thank you for joining today and taking your time to listen to this presentation. Remember, a journey of 1,000 miles begins with a single step.